Today we will be discussing a very interesting and advanced thing in our oral and maxillofacial surgery procedures. That is the use of lasers. Now, without discussing the basic physics of laser and all the basic things about lasers, it is almost impossible for me to make you understand anything about lasers. So, in one class, it is almost impossible to cover all the things. So I have just briefed everything in a concise manner. Let's see if you have any issues in understanding, just let me know. Now, the first successful demonstration of laser was performed by Myman in 1960, who also predicted one of its used to be in medical sciences. The term laser stands for light amplification by stimulated emission of radiation. So it is a stimulated emission of radiation. Okay, what type of radiation? It is the electromagnetic radiation that is similar to light. So it is an amplified light. Okay, light amplification by stimulated emission of radiation, and was first used by Gordon Gould in 1957. Let's discuss the laser physics briefly. Modern lasers are simple to use but lack a knowledge of the physics of laser. Inadequate training and caution in handling lasers can give rise to potential adverse outcome and unwanted complications. Now, while using laser, it is very easy to buy a laser setup, but if you don't have the knowledge where to use what type of lasers, like there are different types of lasers that works on different types of tissues. If you don't have the knowledge where to use which one laser, so that will lead to many kinds of mishaps. So in this class, we will be understanding what types of laser we will be preferring in what types of conditions. Okay. The laser, as opposed to a regular light source, is.
Ever wondered how a laser can cut tissue without a surgical blade? Laser stands for light amplification by stimulated emission of radiation. Unlike ordinary light, laser light is coherent, monochromatic, and highly focused. When laser energy reaches tissue, it can be absorbed, reflected, scattered, or transmitted. Absorbed energy converts into heat, allowing precise cutting and coagulation. This means less bleeding, reduced swelling, and improved visibility during surgery. Common surgical lasers include diode, CO2, ND:YAG, and ER:YAG lasers. They are widely used for soft tissue surgery, lesion removal, and biopsy procedures. Laser surgery often promotes faster healing and greater patient comfort. Understanding laser physics helps surgeons deliver safer and more predictable outcomes.
In this case, it is a hollow arm, okay, hollow wave guider. And in this case, it is a articulated arm. This articulated arm has multiple mirrors inside. Okay. Now, lenses focus the active laser beams to create a focal point. The focal point at which the energy is condensed to the smallest area to create the maximum effect. So now the size of the focal point. The smaller is the size of the focal point, more is the effect, more the energy is condensed in that area. When the focal point is large, the energy is dispersed. Okay, the energy is dispersed over a wide area. Okay, say for example, you had 100 photons. Okay, you had 100 photons. Now 100 photons are concentrating in a small area. It will have larger impact. Whether 100 photons dispersing over a large area, it will have a less effect on the tissue. Okay. Now, the depth of penetration here will be more. The depth of penetration here will be less. Now, some fiber optic laser system utilizes a quartz or sapphire crystal at the tip of the fiber to enable the beam to be absorbed by this crystal and allow contact with the tissue at the tip of the fiber, while others are used in non-contact mode. Now, this crystal, the quartz or sapphire crystal, it absorbs the laser beam, it heats itself, and this heat results in thermal cautery. Okay. A laser beam is an electromagnetic beam of radiation which can fall anywhere in the spectrum of visible or invisible light. Now, NDER, carbon dioxide, RBM laser fall into the infrared invisible spectrum. Hence, they are often accompanied by a visible aiming beam. Many a times, if you have seen a laser, you will see one.
Ever wondered how lasers produce such precise and powerful light? Laser stands for light amplification by stimulated emission of radiation. Unlike ordinary light, laser light travels in a single focused direction. This property is called collimation, allowing minimal beam spread. Laser light is also coherent, meaning all light waves move in sync. It is nearly monochromatic, containing one dominant wavelength. Inside the laser cavity, stimulated emission amplifies light repeatedly. In medicine, lasers enable precise cutting with minimal tissue damage. They're widely used in ophthalmology, dermatology, and modern surgery. Understanding laser physics helps unlock the future of medical technology.